Hello and welcome to this special broadcast. The COVID numbers are rising across the country with the second wave of COVID-19 proving more lethal than expected. What is more concerning is that even younger people are at the receiving end in this wave, in this phase. Now, there are several questions that are doing the rounds as our vaccination drive, COVID vaccination drive, focuses more on the elderly and middle-aged so far. How vulnerable are infants to the second wave of COVID-19? Is it time for some special care for the little ones? Is vaccinating those below 18 or toddlers an option, or is it not required at the moment? Can the threat be ignored at a time when a sizable number of children are also getting infected across the country? In fact, the numbers have been quite high in places like Delhi, Maharashtra, Uttar Pradesh, where a large number of children have also been infected by COVID-19. Well, to discuss this and much more, I'm being joined by Dr. Prakritish Bora, HOD Pediatrics, Excel Care Hospitals, Guwahati. I'm also being joined by Dr. Noinmoni Deka, Pediatrician, Pratiksha Hospital, and Dr. Rakesh Periwal, Critical Care Consultant, Apollo Hospitals, Guwahati. A very warm welcome to all of you, gentlemen. If I can go to Dr. Prakritish Bora first. Dr. Bora, welcome to the show. Well, it's been assumed so far that children have been faring well against the virus, but what we are witnessing in the second wave is that an increasing number of infants, children, toddlers are also getting infected. Even they are requiring hospitalization. Well, how vulnerable are our children in this second wave of the pandemic, Dr. Bora?
Yes, you're correct. We are seeing a lot of children getting infected in the second wave of the COVID-19. And however, the severity of the illness is not so much. We are seeing children, they're getting affected with symptoms which are mild. We are yet to see children who are very, very sick, who develops pneumonia, gets breathing difficulty, and has to be given ICU care. So that kind of children are not as many as of now. But as the time goes, I'm sure the wave is still picking up. So in the near future, I'll not be able to tell you exactly now how the situation will be. But we are prepared, and we have a few children who has been admitted, but luckily, we have been able to manage them with the minimal medications like the antiviral medications and the supportive medications.
All right. Dr. Noinmoni Deka, the same question to you. How vulnerable do you feel are the children?
Yes, thank you. Thank you for inviting me in this platform to deliver my opinion regarding this COVID-19 in children. So really, it's a very whatever news and information we have received from our friends across India is that this time children are not affecting less than the adults, because in some pediatric hospitals in Maharashtra, Mumbai, Delhi, whatever reports they have given till now is that lots of patients has been suffered from these COVID-19 infections, not only the asymptomatic infections as we have seen last year. This time, as cases load has been increased, the severity of the disease also has been increased in younger population, specifically these younger children. So some of our friends have mentioned that many more children are in high flow oxygen system, many are in ventilator, few also succumb to death, and these are the real situation. Although this situation we are not facing till now in Assam, so nobody can say that this situation will not come to Assam. So we should be very much vigilant and we should be very much strict. And one more important thing is that although some of the children become asymptomatic in this phase, later on they might develop some very dreaded complications, whatever we used to see, or we used to call it as MIS-C, multiple inflammatory syndrome of childhood. It's like a Kawasaki disease-like presentation involving the multiple systems of the body, affecting the heart, central nervous system, lung. So there might be lots of complications later on also. So we must be very, very having some stringent view and regarding this outcome of the children, and what further steps can be done to prevent, because these are their budding young generation, so we should not take them very lightly. Previously, whatever we have been told that those children are having some asymptomatic infections. No, it's not like that. They might have some symptoms which might be very much severe enough, which can even might even be fatal. So we should be very much vigilant to in this age group.
Dr. Bora, Dr. Prakritish Bora, is it you as you mentioned that yes, the infection level found in children have been comparatively low so far. That can probably also be because our children are still protected, mostly staying indoors. I mean, today the cases in Kamrup Metro crossed the 1100 mark. So all the elementary, primary schools are already closed. The kindergartens were closed. Now even schools, colleges, everything will be closed. So children are usually protected. Being in a protective environment probably could that be one of the reasons for the lower infection levels probably, and if they are also exposed to certain conditions, maybe that may change. Is there a threat of that, Dr. Bora?
Yes, see, if you compare the last wave to this wave, the present wave, we are seeing many more children. The number of children getting infected has really increased. So I would say that because last time there was a lockdown, the schools were closed, and then when the infection came down, the schools reopened, and there were a lot of people got became a little lax with precautions. So that is probably one of the reason for more infections being seen this time on. And the second thing might be because we have the mutant variety of the virus, which has doubly mutated. So we have two mutations happening in the virus, which is being seen in India, and the other varieties like the UK variety. So, so with these reasons, I mean the mutant variety of the virus, and the schools being open and other institutions, seeing a lot of gathering of people. So probably those are the reasons that we are seeing more children getting infected this time. But as I said, as of now, we are not seeing children becoming very very serious with illnesses of with COVID illness. But time has to, we have to wait and see how bad the children become later on in due course. But as you said, that children remain in a protective environment. Now if the schools are closed and if other institutions are closed, then children will mostly remain at home. So they will remain in an environment which is more protected than active adults. So yeah, there is a possibility that when we compare with adults, we still probably will have less children getting infected than comparatively. The adults will be more and children will be less. Yes.
Yeah. I believe we also have Dr. Periwal connected. Doctor, okay, we are yet to be joined by Dr. Periwal. Dr. Nayanmani Deka, do you think children are still better off in fighting the virus, in fighting the infection, given their stronger immunity than say the elderly? Do you think that still holds good despite the second wave?
Yes, to some extent it's possible, but thing is that because of their increased immune response, they might not have complications during the time of disease, but because of this hyperimmune response, they might develop some complications on later part of the disease when the disease become recovered. At that time, they used to develop these complications. So that is a very dreaded complication, as already I have mentioned. That is called MIS-C, multiple inflammatory syndrome of childhood. It is because of hyperimmune response of the body of the children, which lead to the effect in different organs, as I have already mentioned, like in heart, or previously we used to have a term, a disease is called Kawasaki disease. Kawasaki disease like presentations. We last time, after the wave was gradually decreasing, we used to get cases of this type of complications, this Kawasaki disease like presentations having effect on heart and multiple systems. So this time also you can say, after although at the current juncture we are not getting so much symptomatic patients, although rest of the country is getting. But yeah, as the wave is coming, as the wave is going behind, we might see lots of cases with complications of this hyperimmune response. So definitely, it's because of immune response, child might be protected from the initial phase, but later on they might develop complications. So that's why this part is very much, although all the things are not very much clear, but whatever cases we have got, so definitely it's a major concern.
Dr. Periwal, Dr. Rakesh Periwal, well, we have had over 1100 cases in Kamrup Metro today. The second wave seems to be at our doorsteps, Dr. Periwal.
Yeah, it has arrived. I think it's knocking and knocking very hardly. And I think it will be probably the same of what is happening elsewhere. You look at the number of cases which have poured in, just seen has changed in last 10-15 days. You're just building up our capacity, and I hope just we are able to do with what we had last time.
Dr. Prakritish Bora, do you think that there is also a need to vaccinate the young ones? Is that possible, or do you think that is not required at the moment? The situation does not demand the same, or we have more priorities because as it is, the infection levels are still less somehow in most parts. So probably that is not required at this moment. What is your opinion?
See, we absolutely need to vaccinate the young generation also, because number of infections has been, we are seeing more number of children getting infected, and if more children get infected, then they'll tend to infect more adults. And of course, the priority has to be people who are more than 50, 60 years old, or with more comorbidities, who will be predisposed to have severe disease. Those people should be given the priority, as the government has already given. But now that UCO has already announced that they probably will be vaccinating children below 18 years from the month of August. So I am sure the vaccine, the potency and the safety of the vaccine in children will be established. And once we establish that, and once the other countries have given vaccination to children, then India should also take the lead in vaccinating our young generation as well.
Dr. Nanvani Deka, well, children are also very prone to cough, cold, fever, tend to catch especially cough and cold very easily. Do you think under the circumstances even the common cough and cold will be treated with suspicion by people, because that is how the scenario is, and should be treated with suspicion, or do you think there is no need for extra worry, especially for
No,
the
no.
parents?
In this current no, thing is that in this current pandemic situation, you you try to project every child with having fever, cough, like upper respiratory infection like symptoms is COVID until proof otherwise. So thing is that yes, you need to have a strong suspicion of this COVID-19 in having all these symptoms. And if you are doubting and need to do the test in because this is a pandemic situation affecting all the everybody, not only children, adults, it's affecting whole the family members and the children. So definitely we need to have strong suspicion if the symptoms are like that, and we need to do testing and all, and then and after testing we can exclude. But first thing is that they are COVID until proof otherwise in this pandemic situation.
Dr. Prakritish Bora, any specific symptoms for children that we should look into, that we should look out for rather, as far as COVID is concerned, anything that you have come across?
Yeah, this time on the COVID, the symptoms have been a little different, not only in adults but in children as well. So last yesterday only I saw a child who was vomiting repeatedly, and he came to our emergency and he was found to be COVID positive. And then I had one child who had just red eyes. He did not have fever, he did not have cough, cold, or anything. He just had red eyes, and he was found to be COVID positive. So COVID is coming with lot of unusual symptoms. So to name a few, like loss of taste and taste and smell is not very common in children, but the GI symptoms like vomiting, loose motions have become quite common, and then again rashes on the body, and then red eyes, as I said. So these are uncommon symptoms that children are coming to us with COVID infection. And besides this, the normal cough and cold, fever, sore throat, all this will remain. And of course, we are yet to see children who with severe pneumonia, with developing respiratory distress and other symptoms.
Dr. Periwal, well, we are in times where even stepping out of our homes without a big need probably is not advisable, and children, as I said, we are discussing COVID in children. Is it a big threat in the second wave? Well, children have a lot of complications they can have a lot of complications on a daily basis. How difficult does it get for the parents, for the wards, to identify the symptoms, and even rushing to a doctor is not an option, not an easy option, because even parents are reluctant to go to a doctor. That involves probably visiting a hospital or a nursing home or a clinic, probably best avoided these days, isn't it?
I think it's a very logistic problem as even a child becomes infected, because it is very difficult to isolate them. That is number one. Who will take care of them? They need care all the time. And they are the one who mix with a lot of generations, especially the grandfather, grandmothers. And as we said, even if the children come up with mild symptoms, they have the potential to kind of spread it to the elderly. That is one major concern. And the other concern also becomes when the children are positive, many a times you see the parents are also positive. Then it just compounds your problem. And the hospital availability of beds and allocation of wards for children. I mean, pediatric COVID care, I don't know what my fellow pediatricians would tell, but is not as evolved in terms of space provision for them in hospital as it is for adults. We have an adult ICU, a ward, but those facilities are not there for children. So it's very difficult to get the institutional treatment as well. And you can't keep them in quarantine centers. It's very, very complex in terms of disease and its communicability. And in children, it's more than what it manifests. It's the all logistic issues that it creates.
Dr. Bora, I will also take the reaction from Dr. Dekka. Dr. Prakritish Bora, how challenging, as Dr. Periwal here mentioned, how challenging is special intensive care when it comes to pediatrics? How complex it is? You have been dealing with it day in and day out.
See, as Dr. Nanmani Deka has already mentioned, that that intensive care work that we had to do was mostly with children who had MISC, the multi-system inflammatory syndrome in children, but which is mostly post-COVID. I mean, the child will have COVID and then he'll land up with MISC, and then his multiple systems are involved, and we have to deal with him in the critical care unit, and and many a times we have to ventilate, and but because the child is already developed an antibody, the things were easier because we do not have to use all the precautionary measures that we normally need to handle a child who has active COVID. So when we have an active COVID child who develops pneumonia or who requires intensive care, that will be the challenging part, because the adults are geared up with ICUs. They have separate ICUs for COVID patients and from the normal adult ICU patients. But in pediatrics, we are yet to segregate this too, because the number of sick patients that we had last time was not many. But however, with the increasing number of infections that we are having now, the possibility of seeing more sick children with pneumonia and other complications will be higher this time. So the challenge to manage these children in the normal ICU will be really difficult. So we basically are actually, what we are doing is we are segregating the ICU to have these children, and so that we have a separate COVID kind of pediatric ICU, and we have dedicated a couple of beds in our hospital. So where if a child of this kind lands up and we have to manage, then we'll put the child in this segregated area, and then we know all kinds of intensive care can be done. But it is always difficult because wearing a PPE kit, then intubating a child and managing everything becomes a little bit difficult.
Absolutely. Dr. Nanmani Deka, it's again very difficult to segregate a child, especially an infant, from the parents. Children below 4 years of age, very difficult. So it's a double challenge probably. If the child is somehow positive, the parents are not. probably we have no other option, but still the mother at least has to be with the child, and it's like risking another infection because there is no other way out, isn't it?
Yes, yes, definitely, definitely. It's very difficult to segregate children from their parents. So it's a very challenging task. In fact, if you see the some COVID positive mothers when they get delivered, regarding breastfeeding, also there are lots of controversial things whether we need to feed that child or we need to keep the child with the mother. Although some guidelines used to say that you can keep the baby with the mother. Some used to say that no, better to isolate the baby from the mother, keep it in a separate nursing care. So it's a very challenging task basically in specifically newborn babies who used to get delivered from COVID positive mother. We are regularly facing these problems. So and it's a really very dilemma what to do, what not to do, and things are sorted out somewhere in between. We used to take parents' consent also. We used to inform them that these are the possibilities if the baby has been kept in with the mother, and if not kept with the mother, what are the possibilities, what are the possible complications. So we need to inform them. And after informing all this, we need to take some informed consent from the parents, and after that we need to decide. So these things are very difficult. Is very how to handle is very difficult because lots of consensus are coming on. Some used to advocate, some don't advocate these things. So really, it's a very challenging task.
Dr. Prakritish Bora, last question. Well, as far as pediatrics and COVID is concerned, are we still learning each day, even as doctors, health workers, are we learning each day how to tackle new challenges?
Absolutely. We are still in the learning graph. The symptoms are changing. The way COVID behaves in people is changing, and we are seeing new mutant variety with the ability to infect more people. So yes, I would say we are still learning with the difficulties of COVID in terms of symptoms, in terms of complications, in terms of the way to manage. Like last year, we were prescribing multivitamins to all the children so that we can prevent the disease. But this time on, we have come to know that there is no role of multivitamins. There is hardly any role of hydroxychloroquine. There is hardly any role of azithromycin. There is hardly any role of ivermectin. So the drugs which were like the prime drugs that we were prescribing last time on has really come as a different surprise that they are no more probably useful. So yes, with the way we are looking at COVID at this point is completely changed, and I'm sure as the days go on, things will keep on changing and newer developments will keep on coming.
Absolutely. Dr. Periwal, Rakesh Periwal, you have been assigned duties in the COVID care units for hours. You were there in the last COVID wave, and it's good to see you smiling always. That has been the spirit of the frontline workers, ready for the second challenge, which we hope is at bay as far as northeastern Assam is concerned. Dr. Periwal.
I think the numbers are just one thing which can just overwhelm us. That is the major problem. Or else, okay, the behavior of the disease is changing definitely. More younger people getting infected, more people having city lesions, maybe more deaths, and maybe because people are not getting healthcare services as easily. Look at the situation in the metros. Some people are also dying because of poor healthcare facility. So it's a very complex equation that we have. We just hope that the numbers are enough that we are able to serve. If that's the case, maybe we deliver the goods, or else it will be very overwhelming for us even.
Absolutely. We just hope things are under control. Thank you so much, Dr. Noenmani Deka, Dr. Prakritish Bora, Dr. Rakesh Periwal, for your inputs, valuable inputs on this issue. That's a wrap of this special COVID broadcast.